A public service announcement, emergency psychiatric treatment. This message is brought to you as a public service of His Holy Name Ministry and its Catholic Mental Health Ministry, and the Independent Catholic Podcast. Look us up on the web at His Holy Name, one word, Ulisite, one word.com.
Emergency psychiatric treatment. A psychiatric emergency is a disturbance in thought, mood and/or action which causes sudden distress to the individual, others, and sudden disability or death, thus requiring immediate management. Common psychiatric emergencies include, but are not limited to, suicidal attempt, deliberate harm to self or others, acute psychotic episode with excited behavior and violence, alcohol and drug withdrawal syndrome and delirium tremens, depressive stupor or catatonic syndrome, acute stress reaction with dissociative conversion disorder, panic disorder with panic attacks, dystonic reaction due to psychotropic drugs. Emergency psychiatric care requires an immediate emergency room visit at your local hospital. Call 911. The general management of a psychiatric emergency includes secure safety of the patient. As patients are at high risk for suicide and violence, health workers should always take appropriate measure to prevent them. Hospital staff will closely observe the patient or restrain the patient if it is determined that they are at risk of harming themselves or others. The police may be involved if legal concerns are involved. A majority of states have criminal statutes specifically addressing assaults on emergency medical providers, and 32 states make it a felony to assault a health care worker or emergency medical personnel. Physical injury is legally defined as impairment of physical condition or substantial pain. Under this definition, not every assault is considered a felony. The health care provider may press charges and the rest will be up to the legal system. Once the patient is admitted to the emergency room, they may be transported to a designated area in the emergency department for psychiatric treatment, which will include seeing both medical and psychiatric providers and possible medication administration either by mouth or injection. Medical and psychiatric assessments will then be performed and as thorough as the patient is compliant. Some psychiatric conditions may have physical components, and some psychiatric symptoms may mask ongoing physical issues. This may require additional lab work and testing. Patients with severe mental illnesses die about 10 to 20 years earlier than the general population, that 1 out of every 5. Mortality in severely mentally ill patients is 2 to 3.5 times higher than that in the general population. Once the patient has been evaluated, it will be determined if the patient will be discharged with outpatient services, admitted to a medical floor or admitted to an acute psychiatric crisis unit. In order to be admitted to an acute psychiatric crisis unit, they must be deemed medically cleared by the emergency room. This may include additional lab work, breath alcohol reading or readings, urine drug toxicology, and an electrocardiogram or EKG. If the patient is considered meeting criteria for admission to an acute psychiatric crisis unit and refuses to be admitted voluntarily, they can be admitted for involuntary treatment in accordance to state laws. Transport of psychiatric patients from the emergency room to an acute psychiatric crisis unit is typically not allowed by family or private car and will be